Hey there, history lovers. Today we're diving into something that might make you squirm a little: ancient Roman surgery. Before you click away, I promise this is going to blow your mind. Did you know Romans were performing brain surgery nearly 2,000 years ago? And some patients actually survived. Stick around because I'm about to share some surgical techniques that will make you grateful you live in the 21st century. So picture this. You're in ancient Rome. It's around 100 CE, and you've got excruciating pain from a bladder stone. Today, that's a quick procedure with minimal recovery time. Back then, you're facing a surgeon with bronze tools and zero anesthesia. Yet somehow, Roman doctors were performing this procedure with a surprising success rate for their time. The Romans inherited much of their medical knowledge from the Greeks, particularly from Hippocrates, but they didn't just copy, they innovated. Military campaigns created a constant stream of injuries that Roman surgeons had to treat, essentially turning battlefields into surgical training grounds. Roman military surgeons became specialists in traumatic injuries. They had tools specifically designed for extracting arrows and closing wounds that would look somewhat familiar to modern surgeons. Some legions even had dedicated medical units with specialized personnel in field hospitals, the earliest examples of organized military medicine. One of the most impressive Roman surgical innovations was the treatment of cataracts. Using a needle-like instrument called a sciathoscomyle, surgeons would push the clouded lens aside, instantly restoring some vision to the patient. Without microscopes or modern sterilization, this procedure required incredible precision and nerve. Then there's trepanation, drilling holes in the skull to relieve pressure or treat head injuries. Archaeological evidence shows many patients survived this procedure, with skulls displaying healing around the surgical sites. Roman surgeons knew enough about brain anatomy to avoid critical errors, and they understood the concept of increased intracranial pressure. What's truly fascinating is their surgical toolkits. Excavations at Pompeii uncovered nearly 200 different surgical instruments, from forceps and scalpels to bone drills and specialized gynecological tools. These weren't crude implements. They were precisely crafted from bronze and sometimes steel, with specific design for different procedures. And the Romans weren't just cutting blindly. Medical tech from physicians like Galen and Celsus show they had detailed anatomical knowledge. Galen's writings on the circulatory system remained the standard medical reference for over 1,000 years. Roman surgeons understood enough about infection to use wine as an antiseptic and vinegar to clean wounds, practices scientifically proven to have some antibacterial effects. But let's be real, Roman surgery was brutal. Without effective anesthesia, patients were given opium or alcohol and then physically restrained. Speed was essential, and surgeons prided themselves on quick operations to minimize suffering. Imagine having your leg amputated while fully conscious, with only wine to dull the pain. The psychological trauma alone would be devastating. What's most remarkable is how these ancient techniques influence modern medicine. The surgical instruments we use today have evolved from these Roman designs. Their systematic approach to diagnosis and treatment laid the groundwork for modern medical practice. Next time you visit a doctor's office, take a moment to appreciate how far we've come. That comfortable chair, those sterile tools, and especially that wonderful anesthesia, all luxuries ancient Romans couldn't imagine. Yet without their pioneering efforts, who knows where medicine would be today? If you found this fascinating, hit that subscribe button and comment below with what ancient medical practice you'd like me to cover next. Until next time, stay curious and be thankful you weren't born in ancient Rome with appendicitis.